Hello everyone, I'm Carissa Alvinia, and in this video I will be discussing about gonorrhea. Gonorrhea is a sexually transmitted disease caused by infection with the Neisseria gonorrhea bacterium. Neisseria gonorrhea infects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men. Gonorrhea can be transmitted through direct or indirect contact and mother-to-child transmission. The epidemiology of gonorrhea. Gonorrhea is a major public health concern. It is currently the second most common cause of bacterial sexually transmitted infections worldwide. The World Health Organization estimates that 106 million new gonorrhea cases are documented among adults annually worldwide. Many more infections go unreported. The risk factors of gonorrhea. Sexual exposure to an infected partner without barrier protection, such as failure to use condom or condom failure. Multiple sex partners, male homosexuality, low socioeconomic status, history of concurrent of past STDs, exchange of sex for drugs or money, use of crack cocaine, early age of onset of sexual activity, pelvic inflammatory disease. So the pathophysiology of gonorrhea. As I've said earlier, gonorrhea can be transmitted through direct and indirect contact and mother-to-child transmission. In direct contact, it can be transmitted through exudates or secretions of mucous membranes, and in indirect contact, it can be transmitted from fomites, and in mother-to-child, it can be transmitted through contaminated vaginal secretions. Neisseria gonorrhea adheres to the epithelium by utilizing its own villi, which will allow them to attach from a distance and move in closer to the epithelial cells. The bacteria will then penetrate to the mucosa. As the body detects a pathogen, it will promote inflammatory response and form abscess, which will then manifest the cardinal signs. These are redness, pain, heat or burning sensation, and swelling. It may obstruct the drainage of the small abscess and become large abscesses. The scarring formation will then occur. If left untreated, men may experience epididymitis and affect its sterility. In women, it affects the uterus, fallopian tubes, and ovaries, which can cause infertility and ectopic pregnancy. So as the small abscesses become large, the infection spreads along mucosal surfaces and travels through the bloodstream, which will then result to severe conditions. The clinical manifestations of gonorrhea. Many men and women with gonorrhea are asymptomatic. However, when present, women may manifest greenish yellow or whitish discharge from the vagina, lower abdominal or pelvic pain, burning when urinating, conjunctivitis, bleeding between periods, spotting after intercourse, swelling of the vulva, burning in the throat, swollen glands in the throat, and in men, greenish yellow or whitish discharge from the penis, burning when urinating, burning in the throat, painful or swollen testicles, swollen glands in the throat. The complications of gonorrhea. In women, pelvic inflammatory disease, infertility, increased risk of HIV or AIDS. In men, epididymitis, disseminated gonococcal infection, infertility, and increased risk of HIV or AIDS. Complications in babies, blindness, sores on the scalp, and infections. The diagnostic or laboratory procedures that will be used in diagnosing gonorrhea. urinalysis in the cervical or vaginal specimens using nucleic acid amplification testing, gonorrhea culture, pharyngeal and/or rectal swab specimens. The treatment for gonorrhea: intramuscular dose of ceftriaxone with oral azithromycin. In babies, injection of ceftriaxone. The nursing diagnosis for gonorrhea: acute pain related to the reaction of infection, hyperthermia related to inflammatory reactions, impaired urinary elimination related to the inflammatory process, anxiety related to the disease. The nursing interventions for this condition: examine in a comprehensive pain include location, characteristics and onset, duration, frequency, quality, intensity or severity of pain, and precipitation factors. Monitor the temperature at least 2 hours. Monitor urine elimination include frequency, consistency, odor, volume, and color appropriately. Assess the level of anxiety and physical reactions to high levels of anxiety, such as tachycardia, tachypnea, nonverbal expressions of anxiety. The prognosis of gonorrhea: appropriate treatment with the recommended antibiotics should resolve gonorrhea infections. In women, infections usually resolve spontaneously. However, in both men and women, untreated infections may result in